All right.
Uh-huh.
Okay. Well, um, so today we're going to find out what life is like in Australia, where all the deadliest snakes in the world live. By the way,
Yeah.
what's the deadliest snake you've ever seen?
That I've ever seen. I think I saw a brown snake once. I mean, I'm a very urban girl, so there aren't a
All
lot of
right.
snakes in the cities.
All right. So I'll
Yeah.
introduce you. This is my really great friend Christina, and we used to be neighbors in LA and did some funny or die videos and some other videos together.
Here's your prescription. We go in the next round.
I'm the realest girl on here.
For today's podcast, I'm going to be interviewing one of my neighbors who was born in another country. Where were you born?
Australia.
And what's your name?
Christina.
How do you say that in American?
Christina.
It's been a really great scrounging morning in ballet. I got myself a whole new outfit. Let me tell you all about it. So
And she moved back, 10 years ago? Moved back to Australia?
2011.
Yeah, so
9
9
years.
years ago.
Yeah.
And since then, you're now quarantined like everybody else with a cup of coffee
Yeah.
in your home. So I guess let's first of all ask, what's what's life like there right now?
Um, it's definitely quieter. Um, it's interesting. I mean, in Australia, our rates of infection are not as high as a lot of other places in the world. I think that's by virtue of we're a long way away, and we're a very large country with a relatively small population. So we're more spread out. Although the cities are still pretty congested. So um, it's really the kind of tighter restrictions have come in just in the last 2 weeks, really. Although one of the first signs of okay, shit is getting real was the Grand Prix, which is a massive international event, and it's held in Melbourne, got cancelled the day before it was supposed to start.
Oh wow.
Um, Probably a call that should have been made a little sooner. But like it just obviously there was probably tension around it's a big money event and we don't want to cancel it if we don't have to. But then obviously it was like, we have to cancel this. This is hundreds of thousands of people congregating for 3 days in one spot. This is insane. So that got cancelled. And that was really the first big event like that got impacted. We've we've just been through summer, so there were a number of lots of summer music festivals and things that were happening through January, and there was a lot of bushfire relief stuff happening as well
Oh
because
gosh,
we've just
yeah.
had
Because you guys
that
almost just
come through.
completely burned up.
Oh my god, it's like the apocalypse. Like first we
We
had fire, and
uh,
now we've got pestilence.
we got Trump and you got giant flames. So two things
Yeah,
trying to destroy countries. Yeah, because so
yeah,
a month ago, you guys, well, right now you guys have about 5,000 cases and
yeah,
about 30 deaths. And a month
yeah.
ago, you guys had about 300 cases in your first death. So it's climbed
Yeah,
quite a bit.
it has. Yeah.
Um, Actually, it was like 50 cases like a month ago. So is that, I mean, clearly we're at 300,000 cases and we were at 8,500 deaths. A lot of those are in New York, but still, is that a thing that's kind of looming there? Like, do people think, wow, look at the rate? Or do people look at that like relatively that's pretty low compared to other countries?
No, I think it really has sobered people up because we had teeny tiny numbers through January and February. And as you say, even a month ago, they were still pretty small, but we're now at like over 1,000 in Victoria, which is the state that Melbourne is in, and about 2,000 in New South Wales, Sydney. Infuriatingly, so they're our two most populous cities, so it makes sense that we would have the largest numbers. Um, and the cruise ships there are a lot of them dock in Sydney,
Oh,
and And even though there was that whole Diamond Princess thing off Japan, which was just, there were so many people infected on that ship. When the Ruby Princess docked in Sydney a couple of weeks ago, everyone was let off. No one got tested. Everyone was let off that boat without being tested, and went out into populous Sydney, and that's when their cases spiked.
Yeah, exactly.
There
Thanks
has been
for
really slow response. I think we have been a bit like, oh, we're far away, our numbers are low, we're going to be fine. So the government has been slow to respond. And interestingly, a little bit like the US, although I think not quite as extreme, our federal government has been slower than our state government. So a couple of our state government leaders, so like your governors in Victoria and New South Wales, they have come out much more strongly and much more clearly in their direction about what their population should be doing. And they've kind of dragged our national government along a little bit, kicking and screaming, like, oh, okay, because the national government's been a little bit vague, and like our Prime Minister a couple of weeks back was sort of saying, you know, there's all this question about essential services versus non-essential services, so who should shut, who should remain open to support the community. And he was like, well, but you know, all jobs are essential. It's like, yeah, dude, but that's not really the point right now.
And he's had a bit of mixed messages, because he said this is the worst thing that you guys, like every 100 years, it's been since World War I, you guys have had something like this. At the same time, he says this thing can go on for 6 months. And then Morrison also said, you know, stop hoarding, and stop fighting the store. So I got to assume that there is some panic going on where you're at, because that is a thing.
Yeah, there is. And toilet paper was the first thing that everyone panic bought. It's just, it's sort of settled down a little bit now, the panic buying. I think there was an initial, you know, panic, and then I think it's calmed down a bit, because people are realizing that the shelves keep getting restocked every day. So if we just buy normally, then there's enough for everyone, it'll be fine. But you can understand why people are buying maybe not more in their normal shop than they would normally, because we are wanting to stay at home. And when we need the supermarkets to be open, but they are the most crowded places now.
How are businesses affected beyond stores? Are restaurants still open there? Can you go and dine in a restaurant, or is it like a takeout?
You can get takeout. Not all places are remaining open to do that, but I think those that have been able to kind of pivot their business to do, you know, takeaway delivery, have done that or are trying that. I imagine some won't be able to continue doing that, just because financially it might just not be worth it, but they're trying to kind of keep the lights on and keep people employed. So, you know, I partly to keep my sanity, I go for a walk every day. I have to get out of the house, keep it a social safe distance from everyone. But I will go to a local cafe that's doing takeaway coffee and like sort of support them. And it's all everyone's actually very respectful of the social distancing and very calm. And so, you know, it feels fine to do that. And I'm glad that that's still a possibility, because I need to get out of the house. Like, you know, my mental health is impacted if I'm not able to kind of go out in the world a little bit and see actual people in real life.
It's hard. It's hard right now, because you want to go out and you want to support a business. But at the same time, you know, I just walked to the liquor store because the liquor store is open, and people have these reasons. Why is that essential? Actually, they've had a really good statement that they've released on why a liquor store is essential. And it does make sense. I mean, clearly there's alcoholics out there. I'm not saying I'm one, but I did just walk to the liquor store during a pandemic. But the concept being is you can't just shut something like that down. And of course, I walk by there, and 3 kids on a skateboard go right by me. They don't care, and they're kids, but they could have gone on the street. They could have done anything. And then I get in the liquor store, and there's a sign that says 8 people at a time. And I walk in there, and I clearly was the 10th or 11th at this point. Everyone kind of looks at each other, and they kind of stare like, I see you're there. I'm going to keep my distance. But, people are just, they still don't know. And there's still that group of people that don't know. And, today was the first day that I've had somebody I know die from the coronavirus. And
wow.
It was somebody who I was very close to 25 years ago. I was close to their whole family. And I've got a message today, hey, by the way, just so you know, and it's a sad tale because she was older and they couldn't be in the hospital room. They had watched her die through the window of the hospital. It's a really, really sad story. So then you think like, well, that, I don't know where I'm going with the story other than the fact that it's like, even though we're supposed to be living this life where we're quarantined and we kind of deem some stuff essential and some things non-essential, where's the fine line that you walk? Do you just live in your house and eat granola bars every day and never go out? Or do you go out and try and make a business survive and hope you don't get it? And what if I had it now and I don't know? And yesterday I walked into a bakery and bought some bread to support the business. And I felt bad and tipped the girl pretty well because she was still working. And I'm scared, like, well, what if I got it from her? But at the same time, like, what if she got it from me? And I don't know I had it. I got pretty sick a month ago. I got the flu, and some people said that could have been coronavirus. I think it was the flu, but still, like, it's a weird time, and people still don't know how to react.
Yeah.
So, I just talked to Paige, that you saw the interview, and Paige, they're highly quarantined and walking around with masks, and they don't allow more than 5 people in a store at a time, and we're not there yet, but they're 2 weeks ahead of us. So I don't know if you guys look at where we're at, and I don't know if you would say, oh, well, we're a month behind where the US is right now, but we won't get there. Or are you guys thinking, wow, we're a month behind where they're at. Let's not make any mistakes and be smart and go, make some right decisions.
I think actually Australia, we probably had the infections coming up around the same time as the US actually. But we're not as badly affected because we're a smaller population. And I think we've had stronger leadership, maybe a little more quickly. There's still, I went to the supermarket yesterday, Saturday, the Saturday shop, and there's still quite a lot of people out on the streets, not as much as normal, as I live in an inner city suburb. It's a bit of a tourist area as well. It's like, I don't know, LA equivalent might be kind of Santa Monica, Venice. So it's lovely. But it's quite populous and there's a lot of shops, although most of them are closed now. But there are a lot of people still out and about, and some people had masks, not many. But there's still quite a few. It's sort of interesting, like when I go out for my kind of coffee during the week, it's much quieter and everyone's keeping a really good distance from each other. But yesterday on the street, it was like people were forgetting that it was a thing and they were just out for their normal Saturday. And I was like, can you just stay a little bit further away from me? So that surprised me actually, because I hadn't been up there it's like every week it's different. Every week I think it feels a little more serious. Every week I feel like we need to take it more seriously. But just the behavior of people yesterday surprised me. That there wasn't more care being taken. And that made me kind of nervous about, I'm blithely out there without a mask because basically I feel like I want the masks to go to the frontline medical people who are literally dealing with it every day. And if I keep, a safe distance, and I don't feel unwell, so I'm not coughing on people or anything, but I'm very careful about not touching my face and washing my hands, I feel like that's probably okay. But yeah, when you've got people almost like brushing past you in the street, like that's not okay.
Yeah.
Not
How has this affected you personally the most?
Well, I'm very lucky to have a job that I can do completely effectively from home. So I'm still fully employed, and I work for a life insurance company. So we believe we provide an essential service. The government hasn't been super clear about it, but I mean, we have to keep paying people's claims. There are people relying on us to keep paying them. So at the very minimum, there's a portion of the business that absolutely has to continue. I'm in communications, so I guess I'm a support function, which if push came to shove, maybe not essential. I don't know, but for the time being, we're still working. In fact, absolutely working my ass off lately. It's just been so much change because the whole workforce has suddenly moved to working from home in the last 2 weeks. So we're doing a lot to support everyone. Our IT team has done an incredible job kind of getting all the technology in place for everyone. And then we've been doing a lot of communication to help people adjust and, guides on using, this, that, and the other collaboration tool and, other key messages and trying to answer questions that are coming in from people. So we've been really busy. So in that respect, I'm very lucky. I've still got an income. I can still pay my mortgage. So that and I'm very grateful for that because I've got a lot of friends who have lost their job. But on the other hand, on a more personal level, I am more of an extrovert personality, and I have really felt just in 2 weeks of working full time at home, I am really missing people and daily interaction with my colleagues face to face, and I do a lot of exercise and I do a lot of classes, and yeah, you can do them online, and I'm starting to find the things that I want to do online, but it's not the same as going to the gym and seeing some friends and working out together. And I've realized how much of my resilience and kind of buoyancy of mood is fed by those kinds of interactions. So I know that I'm going to have to find ways to, readjust. So I get used to I guess a bit less of that, and just find a new routine, and yeah, it's been tough. I've had some wobbly days where I've just felt very kind of weepy, and it's that missing that connection. And I live on my own, so I don't have a person in my house that I can kind of see every day. And there's advantages to that, definitely, to not, sharing a space. But
I'd have to murder somebody after 2 weeks.
you could totally. And like some people have got like kids and like their house is a pandemonium and they're trying to work or, or educate their kids from home or whatever. And that's a whole other different challenge that I don't have. But I really miss people. So
how does this affect you mostly as a performer in the arts?
Oh, well, so I don't do as much of that as I used to. I run a little theatre company and we have an annual monologue show, and that typically goes up in November. So at the moment, we're planning on doing that as normal. We're hopeful that theatres will be opening again and there'll be a degree of normalcy resumed by then. If not, we'll have to make other plans. So, and all the pre-production, the doing a call out for scripts and reading them and assessing them and, choosing them, all that can happen. All that happens kind of online anyway. So that, yeah, we're still planning on that. And I think if we don't do that show, if we can't do it live, then I don't know, maybe we'll get people to perform the monologues in their homes and just put it on Facebook or something. But I'm looking at so many of my friends who are still, working or, at least partly reliant on work in the arts, in theatre or in comedy. The Melbourne International Comedy Festival normally happens in April, and that got cancelled. So there's a lot of artists, a lot of comedians and actors who, rely on a chunk of income from that, that's just gone. And then, these people are always also the ones who are often doing 1 or 2 part-time jobs to like pay the rent. And they're the first jobs that go as well. So,
well, yeah, you and I know a lot of actors. There are people, and these people were actors / something, and both those industries have been cut, and it's really hard for them. And my company, we work with a lot. We do marketing for a lot of theaters, and with a local ballet company and some of the theaters. And not only are they shut down, but they're looking at their following seasons, going, do we? We're preparing art for one of the theaters in town. We're getting ready for they have 5 shows, and they don't know if this stuff's going to happen. And so we don't know. So it's one of those things. We just created an ad for one of them that'll run this summer, and we don't even know what the message would be. Like, sorry, or hey, we did it, or we don't know what it's going to be. And it's a scary thing. It's a scary thing for us. And and a lot of my friends in LA and a lot of my friends here are actors, and in Atlanta and New York. But then again, these were people that had dual jobs. You remember when we were living out there, we were everybody kind of did their thing and to get by and survive. And I don't know how a lot of these people are going to make it right now, because they can't lean on one or the other. The arts are completely shut down, and people say, well, what do we do? Do we do a virtual show? Do we do something online? And it's not as quick, it's not as easy as just flipping a switch, because even when the restaurants say, well, we're just now going to do delivery, people aren't used to that. So these restaurants are slowly failing because that doesn't work. So I don't think it works in theater as well as it's going to either. You can't just say, well, now everything's online. Just watch it online. It's just as great. But I think there's the feeling of going to a performance and seeing a performance. And, it's the same reason of why you go to a movie theater and spend too much money, because I want to just sit in a movie theater and I want to see it. So
the experience.
So I don't know how all this stuff recovers. It's really interesting because Disney just put one of their newest movies on Disney Plus. It was supposed to be in the theater right now. I think it was Onward. Maybe it was in the theater. I don't know. I watched it last night and then I fell asleep. I fell asleep towards the end of it, but I'm going to watch the rest. But I think, God, how are they going to make money on that movie now? How is anybody going to make money on anything? It's a total adjustment. So I don't know. It's a crazy thing. You watch us from afar, and you kind of have to laugh. You kind of have to see what's going on and laughing and to say that the way that we're doing things. And I don't know what you have how do we look when Australians think about Americans during this whole crisis? What do they think?
Oh, we're not laughing. It looks pretty scary, honestly. I mean, you can't even laugh at Trump anymore. It's just not a joke. He is a horror show, and I'm sure that America will survive, but my God, I mean, those predictions of 100,000 to 240,000 people they're predicting may die. That is mind-blowing. That is like a generational impact. But
it's a win. If only 250,000 people die, it's a win.
Yeah, I mean, he's a psychopath. So no, we're not laughing. I think where it makes us feel grateful to live in Australia, where we have you know, a national health system where you can go to the hospital and where, you know, we also have, I guess, a kind of public health system as well. So you can get private health insurance if you want that, or, you know, but you can get treated, you can get help without insurance. And so I think in America, a lot of people's health insurance is within their employment. So if they don't have their employment, then they're really fucked. They're like doubly fucked.
And people are losing their jobs. So it's, you know, when so many people are being laid off and clearly do not have insurance. And when you have, they're saying even just in the state of Idaho, they assume that for every ICU bed that they have right now, in a month, there's going to be 16 to 20 people waiting in line to get it. And most of those will not be insured. And this crisis has just begun. So in a sense it has. And I don't know if Australia itself or you personally, do you see light at the end of the tunnel? And is it just because you're an optimist, or is there really a thing where you look at the way that Australia is going and you look at the way that that people are acting and reacting and taking steps, and do you think like we're going to get through this, or where do you and Australia stand in this whole thing?
I think we'll get through it. Already we are seeing the last, not quite a week, but the last several days, the rate of infection is noticeably dropping. So maybe too early to say we've flattened the curve, but it's definitely trending down in terms of numbers of new infections each day. So that's a really good sign. I don't think any of us should get complacent about that. I think we obviously and you know that's happening now, because 2 weeks ago, you know, pretty much everyone stopped working or started working from home. Like there was and big outdoor gatherings were cancelled, theaters closed down, movie cinemas, you know, closed down. So a lot of these gathering places and other sort of festivals and events that were organised have been cancelled. So it's completely reduced the amount of mass public gathering. And we're seeing 2 weeks later that the infection rate is dropping off, or the new infection rate per day is dropping off. So I do feel like we're on the right path, and we all need to just buckle down and keep at it, because it would easily spike again. You know, if the current restrictions are lifted at all, then it'll go up again. So at the moment,
it's a scary thing to think that if you and I got it tomorrow, we might not know for 2 weeks, and we 10 days from now can go out and just lick everybody we know and just be like, hey, we're all better, and then we're like, ha ha ha, and then it starts all over. So that's a scary thing.
Yeah.
Well, Christina, this is all really, really super awesome stuff. And I thank you, because it's, morning there and getting dark here. And so I appreciate your time, and I miss your face. I'm really glad that I got to see it.
Yeah, likewise.
And I know, I can't believe it's been almost a decade since, wow. So is there anything you'd like to say to the people of America? Just share your wisdom as an Australian. Just don't have it be about snakes or spiders, because those scare me. So go.
No snakes or spiders. They're the least of your worries right now. Look, I think just take the sort of stay at home, stay in place seriously. It is the best way to stop the spread of the virus. And find ways to keep yourself sane while you are at home. Just God, hang in there. You know, I think we're all kind of rooting for each other globally. You know, where every country is affected by this to varying degrees. But I think we're all wanting everyone to come through it. So hang in there, America.
Yeah, and you guys over there too. So, well, thanks, and keep being awesome. And I'll check in with you again, and we'll see how you're doing.
Awesome.
Okay. All right. Bye.